Absolutely. Thank you so much, Heather, for the warm welcome and introduction. So just to give you a little bit of background, a bit more background about me to all of the lovely people who are joining us today and perhaps in the future on this recorded session. So I'm Dr. Carrie Scarff. I'm a doctor of auditory science and audiology, but I'm also a person with hearing loss. And that's one of the reasons why I went into this field. So I think that's important to share right off the bat, so that if you happen to be joining us on this session, you know that you are not alone, or if you have loved ones, family members, people you know who have hearing loss, they are not alone, and we're here to help. So let's talk a little bit about today's topic, which is hearing health, how to know if you have hearing loss. So there's some great information we'll be sharing on that to identify perhaps if you or someone you care about might have some of those signs or symptoms. And also what you should do if you do have hearing loss, because there's a lot of information out there. Sometimes it's hard to filter out the good information from the bad information. So you know that the Kirby Unison organization is very trustworthy, and they've trusted us to share this objective information to you. So again, I'm Dr. Carrie Scarff. I have my doctorate in auditory science, and we're going to be talking about hearing health, how to know if you have hearing loss, and what to do if you do. Just moving between slides. There we go. Here we are. Okay. So where do I work and what exactly do I do with regards to hearing health? So I did my doctorate in auditory science a number of years ago, and I realized that there was a bit of a gap between what we know in science and what we were providing to people in clinics. And so I therefore established a clinic where we provide leading edge research and technology and hearing care to people. And I have a wonderful, talented team of individuals. There's some pictures of them, and we have locations of our clinics all around Calgary, as well as one in Red Deer that we just recently opened. And I should mention, we also do mobile care. So we wanted to make sure that we can provide hearing care help to people, even if it's hard for them to get to us because of barriers to their mobility or transportation. Okay, so let's talk a little bit about, first of all, why we get hearing loss. So it's really important to understand that as we age, certainly after about age 40, age 50, our ears start to wear down, just like many other parts of our body. And that's the number one reason why we see hearing loss. So it's wear and tear of little structures deep inside the ear. And I've shown you a little picture there of a cross section. So a cutaway picture of how our ear works. Sound normally vibrates down the little opening in our ear called the ear canal. It normally vibrates the eardrum, and the little tiny bones in our ear, the smallest bones in our body, they're called the ossicles, and those tiny little bones are supposed to send a vibration through the fluid, bouncing those little hair cells that you'll see in the bottom of the screen back and forth to send the message through the nerve up to the brain. The area that we see the most common deterioration, certainly as we age from wear and tear, is those little tiny hair cells that you'll see there in the bottom picture. They just wear out over time. So if you think of the analogy of driving a car, and the more that you drive, the more that you wear out the tread on your tires. It's very, very similar. And that's why, in fact, people who are exposed to noise, so let's say they work at a factory or they use a lot of tools, their ears wear out sooner than people who don't, because simply those little hair cells are working harder or sooner than people who aren't exposed to noise. So they would get hearing loss before someone naturally would from natural aging. So this is the most common type of hearing loss. It's the one that we deal with on a day-to-day basis. Obviously, there's other reasons for hearing loss. There can be impacted wax, there can be a hole or a rupture to the eardrum, there can be a number of different reasons, but certainly you're going to hear from me that if you have signs or symptoms of hearing loss that we'll talk about in detail in a moment, when you go to a trusted hearing care professional, they'll be able to pull out the reasoning behind your hearing loss. Okay, so this is the most common type, but certainly if you go to a hearing care professional, they'll be able to tell you what your particular hearing loss might be due to. Okay, so why is hearing loss important? Why am I talking about it? Why are we seeing more people around town wearing hearing aids? Why are more people experiencing hearing loss? You probably know at least one person who has some hearing loss, at least one friend or family member who has hearing aids, if not more. It's because simply our population across the world, but also in Canada, our population is aging. And since 2016, Statistics Canada has found that we have a larger population, a larger proportion of the population in the category over 65 than in the category of under 14. And in fact, more recently, in 2021, we've crossed the threshold of having at least 1 million more of these individuals over 65 than under 14. So our population is what they call graying or becoming older. And as I mentioned, things wear out over time. Those little hair cells in our ears wear down with every day that we're exposed to sound, with every year that we're exposed to sound. So that's why you will start to hear more and more discussion about hearing loss. You will see more people wearing hearing aids. You'll talk to more friends who are saying, hey, I'm having some challenges in this or that situation. It's because our population is aging and our ears are aging along with it. Okay, so let's talk about a little bit more about statistics, because this is really fascinating and it might be surprising to you. Nearly half, so a full 48% of Canadians over the age of 60 have at least enough hearing loss that they have difficulty hearing speech correctly. So they have at least a mild hearing loss in one ear, and that makes it harder for them to hear and understand the sounds that people are saying to them in conversations, in dialogue on the TV, for example. So that's a very important number. As I mentioned, the population is aging. We have just a ton of people who are over age 65 in our country, in our city, in our communities, and nearly half of the people that are over 65 have some difficulty hearing. So it's very, very common in our world. What I want to explain to you is what happens when you have this hearing loss. So what's important to understand is hearing loss is not black or white. Hearing loss is shades of gray. And the most common type of hearing loss is shown on these pictures in front of you. Okay, so there's a graph and it shows where the vowels and consonants are found on this graph, which is called the audiogram or the hearing graph. Think about this graph, think about overlaying it on a piano keyboard. From the left, the graph represents how people hear sounds in the low frequencies. As we move to the right, the graph represents how we hear sounds in the high frequencies. And we like people's results, so the little white dashed dots in line, we like that to be as close to zero as possible. That would mean that you could hear all of the sounds below, which include all of the vowels and all of the consonants. In the pictures that I've shown you, I'm showing you a very common graph for somebody who might be over 60, over 65, or maybe 70, whereby, yes, the left-hand side of the graph looks good. You can see that the white dots are very close to the top of the graph, so that means we can hear low frequencies very well without too much difficulty, and consequently, we can pick up vowels, because vowels are much more low frequency in nature. So generally, we don't have too much trouble hearing vowels. But look at the right-hand side of the graph. This very common hearing loss graph moves down on the right-hand side, and it would be showing maybe a mild hearing loss for someone, like I said, between 65 and 70, maybe 75. And because it moves down in the right-hand side, it means we have difficulty hearing those high frequencies. So think of the keys on the right-hand side of the piano, the treble tones or the high frequency tinkly notes and keys. Well, guess what else? And it's very clearly demonstrated here. That cuts into your ability to hear consonant sounds. Okay, so that red oval underneath the graph of this individual's hearing loss represents consonant sounds. The sounds like S, or the sounds of the SH sound, or the F for Frank, or the TH for think. Those sounds are much harder for someone to hear if they have even a mild high frequency hearing loss, like I've shown in this graph. Again, that is 48% of people over age 60 in Canada. So going back to what I mentioned before, it's not like you have hearing loss, 100% or zero hearing loss. It's shades of gray. It's all relative. And the most common type of hearing loss we see is this high frequency hearing loss. And even if it's mild, like the picture shown here, it's going to affect your ability to hear clearly. It's not that you can't hear anything at all. It's that you're not hearing certain types of sounds, particularly consonants, and it will make it seem like people are mumbling or like their voice is mumbled or muffled, and like you can't hear them clearly, and consequently, you won't be able to hear them correctly, particularly in more challenging listening scenarios. Okay, so this is very, very important. Like I mentioned, nearly half of Canadians over age 60 have at least enough, a mild hearing loss, which is enough to affect your ability to hear speech correctly. Okay, let's move on to the next slide, which talks about why it's important to identify hearing loss. So we know, yes, there are a lot of people out there in Canada and in our communities who have hearing loss. I want you to also know that most people are unaware of their hearing loss. In some research from Canada, we found that about 70% of people who were in this large-scale research study that was published in almost 20 years ago, or sorry, almost 10 years ago now, 70% of those people who had some hearing loss were unaware of it. So that's really important. That's a really important take-home message. If other people are saying to you, you know, I think you have some hearing loss, please listen. Most of you are unaware that you have hearing loss because it's usually gradual. Okay, so those little hair cells I showed you at the beginning, they wear down gradually, i.e. our ears and our hearing generally wears down gradually. So we don't notice a big change all at once. We develop these accommodations and make adjustments to try to get around our hearing loss. And we may not even be completely aware of it. Well, 70% of us aren't. Sometimes we maybe don't want to think it's us, and we might think, oh, that other person mumbles, or the TV sound isn't as clear as it used to be. Well, that all may be true, but if people are pointing out to you that you are having some challenges with your hearing, it's important to listen to them, because we cannot self-identify very correctly when it comes to hearing. Okay, most people wait between 7 and 10 years after they actually have hearing loss before they do something about it. And that's just far too long based on the brain research. We'll get to that. So here are some other important reasons why it's important to identify hearing loss, because there are some related health concerns. We know that hearing loss is correlated with increased rates of falls in seniors. Okay, there's a lot of reasons for that, but certainly if we don't have sound awareness all around us and to help know where we are in space, it doesn't help us have good balance. So we're at a higher risk of falls. People who have hearing loss are untreated hearing loss are at higher risk of depression. We know this certainly in seniors. And the most recent and up-to-date studies show people who have untreated hearing loss are at significantly higher risk for cognitive changes for things like dementia. So we'll get to that in detail as well. So very important that we identify hearing loss. Okay, so here are some recommendations from me as to when you should get a hearing evaluation. Okay, not a hearing screening, not a free test that you see on a bus bench. You need a full, thorough hearing evaluation, really, if you're over age 60, because like I mentioned, probably about half of you may have some hearing loss and may just be starting, but it's important to know that so we can monitor that. Maybe it's further along than you think, and we may want to look at improving that, but we need to get that thorough testing done first. The other recommendation is regardless of your age, okay, if you have 2 or more frequent symptoms that we're going to talk about on the next slide, it's very important that you get a thorough hearing evaluation with a qualified hearing professional. Okay, so what are some of the signs and symptoms that are important for you to consider? And these are signs and symptoms that, like I mentioned, you may notice. If you notice them frequently, you would consider it one sign or symptom, okay? And like I mentioned in the previous slide, if you have 2 of these signs or symptoms on a reoccurring basis, so frequently, then definitely it's time to get your hearing properly and thoroughly evaluated. Okay, so here they are. Asking people to repeat. So I don't mean asking, once in a blue moon, someone to repeat something. I mean repeatedly, frequently asking people to repeat. Turning up the television or the radio louder than others. So this can be a hard one if you happen to live alone, but if you have people come over, maybe your family members who potentially are younger than you, and they say, oh, that TV is so loud, take that to heart, okay? Because like I mentioned, you might not notice what you're doing to accommodate your hearing loss, and someone else might if they come into the situation and, for example, hear that the TV is loud or the radio is loud. Take that to heart, okay? More difficulty hearing if people have their back turned. So right now you're listening to me to this presentation, but you're also watching me, whether you realize it or not. There's a lot of important information that you get from visual cues. So if we turn our back and if I start talking and not facing you, you're not going to be getting those visual cues. And also you're not getting as much sound energy from the person talking to you. So someone who has hearing loss will notice their hearing loss more when someone is turned away. Okay, so that's a big indicator. So keep that one in mind as well. Here's another sign or symptom: feeling like other people mumble or like their voices are muffled. Okay. Yes, it's true. We have to remember communication is a two-way street. I'm talking to you and you're listening. And if I'm talking to you and I'm muffled and not speaking very clearly, yes, that can affect how well you hear the people. But if your ears are not picking up sounds as well, you're going to have more difficulty with people who don't speak nice and loudly and clearly also. Okay, so if you have difficulty hearing more than just one particular person, and you feel like more than just one particular person is muffled or mumbles, then that's a very strong sign or symptom that you might have some hearing loss. So add that to your list, okay? Another one that we're going to touch on a little bit more later is what we call tinnitus or tinnitus. So it's just subjective ringing or buzzing in your ears. So if you hear that sound from time to time or all of the time, and there's no actual sounds in your environment, it's important to know this can be a very strong sign of underlying hearing loss. I like to call it the canary in the coal mine. When the ears are damaged, those little hair cells that I showed you, as they get damaged, they don't send as much information to the brain. The brain responds by spontaneously firing or activating. It's kind of like a muscle twitch. And you will hear that as sounds that aren't really there. Okay, so another very strong sign that there could be some hearing loss underlying it. Difficulty hearing people at a distance. So if you're at a board table and there's people talking at the end of the meeting room and you have more difficulty with them, for example, that can be another sign, because if you have normal hearing, yes, those people will sound softer. However, if you have hearing loss, you'll probably mistake or even miss what they say. And finally, feeling like speech is unclear. Going back to that original picture that I showed you, whereby the high frequencies are usually the ones that wear down first, and they're responsible for what we call, consonants. That gives our brain the message that I don't quite, it doesn't give our brain the whole message. So our brain feels like this is unclear. I cannot quite comprehend, interpret, or understand all the information. Okay, so those are the signs and symptoms. Like I mentioned, if you have 2 or more of those on a relatively frequent basis, you should definitely go and have your hearing evaluated thoroughly by a hearing care professional that you trust. Okay, so when should you do this? As soon as you notice any of these signs. Really, the earlier, the better. Here's a takeaway message. If you feel like you can hear but not understand, that really encompasses all of the signs and symptoms that I'm talking about. That's the best way to think of it, because a lot of people come in and say to me, well, it's not that I can't hear. It's that I don't always understand what I hear. It's not always, I might mistake some things. Well, that is reflective of exactly what I'm saying. It's because you've lost some of those high frequencies and some of those parts of the words. It's probably less clear to you. You might not describe it that way, but if you feel like you can hear but not understand, it is requiring extra effort to listen, whether you realize it or not, and that is not good for the brain. It's taking up too many of your resources from your brain. So sooner is better for brain health. And here's what I'm talking about. The Lancet, which is a very well-respected scientific journal, has done a lot of culminations, pulled together a lot of information from different universities and research labs, and they found in 2017, they weren't even looking at hearing loss, they were actually looking at dementia, signs and symptoms, and treatment options, and they found that hearing loss is the top modifiable risk factor for dementia in middle age and beyond, so past age 50. The top modifiable risk factor. If we can modify it, my view, I'm preventative, I'm proactive, why wouldn't we? So very, very important to, look at the research, understand the research, and know, okay, hearing loss is putting us at risk for cognitive changes. In 2020, they updated their culmination of research, and they reconfirmed that hearing loss is still the top modifiable factor related to dementia. So there are other modifiable factors. So we're not talking about genetics, which we can't modify right now. We're talking about things like smoking, and we're talking about things like drinking, and we're talking about things like nutrition and things like that we can modify. Then also, there's some very interesting research coming out of the University of Colorado that showed when we have hearing loss, even if it's mild, and this is why it's so important to do things early, the brain cells that used to be responsible for helping us hear and particularly helping us listen in noise, those cells, if they're not stimulated, they get stolen. That real estate gets overtaken by our visual skills, and we rely more on our eyesight, and we have more trouble listening in noise. And finally, in 2023, just this summer, I was actually away on holidays, and I saw the big news update on, I think it was BNN, I was overseas, and they released information from the Johns Hopkins Medical Center, Dr. Frank Lin. They're doing a longitudinal study to see if wearing hearing devices that are properly fit with full audiological support and care will help reduce and mitigate that risk factor for cognitive changes. Now, we're just at the early stages of this. They've only looked at the first 3 years. We didn't expect to see any differences yet. However, they showed some differences in the at-risk population. So in the people that had cardiovascular disease, in the people that lived alone, in the people who, I'm trying to think of some of the other risk factors, have diabetes, those people showed a 50% reduction in their cognitive changes once they were fit with hearing aids after 3 years. So very promising research for the impact of improving our hearing if we have hearing loss with hearing aids, and how that can help support our cognitive skills. Okay, so why are adults with hearing loss more likely to develop cognitive changes like dementia? There's 3 main reasons, and these are really interesting. We have known for a long time that physical brain changes actually change. So more than 10 years ago, we found out that the brain cell structures actually atrophy in the brain if we don't have proper hearing. We know that from, again, Dr. Franklin. But here's some other research and information that is related to how the brain changes if we have hearing loss and don't do anything about it. And we see this in the clinic every day. If we miscommunicate, if we have hearing loss and are in social situations and we say the wrong thing, we're going to have a lack of confidence. We're going to stop taking part. We're going to start socially isolating. And we have had research in the brain area for decades showing that if we have social isolation, it negatively affects our brain. So that's one of the other reasons why if we have untreated hearing loss, we're at higher risk for cognitive changes like dementia. And finally, this is newer research, but I've been following it for a long time out of the University of Toronto, and it's becoming much more well-known and better evaluated. What we're showing is that the thinking is now that our brain is like a battery. We have a certain amount of energy and cognitive energy and resources. And if we have hearing loss and we have to strain to help us hear in different environments or work harder, it requires extra effort to listen. And that takes away from the energy and the cognitive resources we have for things like making decisions and planning. So some of those executive functions, even memory, vocabulary, for example. So a number of reasons why if we have untreated hearing loss, it's going to affect our brain in a negative way. Okay, so what can we do to support our brain, our cognitive abilities, as we age with regards to hearing? There's a lot of things we can do. Get tested when suggested. You might not know you have hearing loss. That's what the research shows. 70% of you might not know that you have hearing loss. Get tested, get treatment when recommended. It's important not to wait. The research shows the brain actually atrophies, shows changes. The longer that we wait, it becomes harder for us to understand and interpret sounds. And by wearing hearing aids, if that's what's recommended, it helps keep your hearing and listening skills up, even if you're at home alone. There's a lot of sounds around the house. There's your breathing, there's your footsteps, there's the furnace, there's your pets, there's your spouse, there's the TV. Those sounds are important just to keep that brain stimulated. Things to know is that adaptation to hearing aids can take time. It can take up to 18 months or longer. So if you have hearing aids, or if you're getting hearing aids, consistency is key. Much like learning a language, you need to be immersed in that sound signal. So perhaps you have hearing aids and you haven't been that successful. Get back to it, get help, make sure that they're working correctly, make sure that they've been, adjusted or updated at least every 18 months. Most people don't realize, but our hearing changes over time. Just because you have hearing aids from 4 years or 5 years ago doesn't mean they're set for you correctly. So our strategy is to follow up patients every 18 months, retest their hearing, and update the settings on the hearing aids that they already have. And that just helps keep them hearing as effectively as possible, which in turn keeps their brain as effectively stimulated as possible. Now, for everyone, whether you have hearing loss or not, keeping up the listening skills and using that auditory part of your brain is really critical. So listen to music, listen to podcasts, speak on the phone with friends or family, have conversations with people, watch, and most importantly, listen to dialogue on TV and movies. So what should you do if you think you may have a hearing loss based on what I told you and what I showed you about those signs and symptoms? Choose a trusted professional group who knows that the hearing graph I showed you is a starting point. It doesn't tell us much about how you hear in the real world. And for that, there's a lot of other testing that we do, for example, and a lot of other conversations that we'll have with you so that we can give you the proper support, resources, education, information, and potentially hearing aids as a part of that overall hearing care. And to get a trusted clinic, you're going to want to look for an up-to-date clinic that is truly a clinic, not just a big brand store, okay? A clinic that offers all the fulsome testing, who offers hearing protection, tinnitus treatment, and hearing aids, and thorough hearing care treatment. Okay, some of the things, I'll just give you an example of what we do to go beyond that hearing graph is we offer what we call person-centered care. We want to find out about your actual hearing function in the places where you go, the challenges that you have. It's not cookie cutter. It has to be bespoke and unique. The solution has to be bespoke and unique to what your challenges are. Maybe you have challenges because you are still involved in board meetings and there's a fan in the boardroom. Well, we can make some suggestions for that situation. And it might be something beyond hearing aids. It might be a microphone system that you work with your hearing aids. Perhaps you're the kind of person who is very, very active and actually is involved in a lot of water sports. Perhaps we would recommend specific types of hearing devices that are waterproof. So regardless, we want to develop that relationship with you so we understand what your challenges are for. And finally, we want to do specialized important testing so we can figure out how well you understand sounds, not just that graph. And that's what a lot of times you'll get with a free bus bench hearing test. You're going to get a graph. You're going to be, a number. We're looking at the person that you are, the places you want to hear better in. We want to know how well you understand speech. We want to know where you need to hear better, where you would like to hear better. So we do additional speech testing and listening and noise testing. Just a couple quick myths about hearing aids. We're going to get to this in some of our other presentations because this is one of a series of 3 presentations. So a lot of people who don't have hearing aids will hear bad press from their friends about hearing aids that they don't work. And often people will wait too long to get hearing aids because of this. And this is actually a terrible cycle because the longer you wait, the harder it is for your brain to understand the sounds your hearing aids are giving you. So it actually makes it harder for you to use them effective. Another myth is that they are too expensive. Yes, they are a big investment, but there are programs for different income levels. There are programs for people who might have been exposed to noise, etc. So we help guide you through all of that. And we've never turned someone away. There's a program to help everyone. Quick hearing aid update. A lot of people ask me, what's the best hearing aid? There's no such thing. It needs absolutely to be tailored to your hearing loss, to your lifestyle, to where you want to hear better, to what your ears are like. Advanced hearing aids do a lot of neat things, like they can be waterproof. You can swim with them. They're rechargeable. They can stream music to your ears. All of those things we like to base on your needs, and then we tailor to your budget also. Okay, just a quick note about tinnitus. The ringing, buzzing, or humming that you hear in your ears is really created in your brain. Yes, it can be caused by other traumas. It's reflective of the brain's response to hearing loss in most cases. And so that's important. It is an indicator of hearing loss. I like to call it, like I mentioned, the canary in the coal mine. So it is one of those signs or symptoms that you should be thinking about if you have it frequently, and an indicator that you might want to get a thorough hearing evaluation. Okay, so a few quick take-home messages to hear better for you now and in the future. If you have some concerns about you or your loved one's hearing, if you're over age 60, get a hearing evaluation. In terms of those signs and symptoms, if you have 2 or more of them, it's regardless of age. It's probably a good time to get a thorough hearing evaluation. Yes, please also seriously consider getting treatment if recommended. It's important to support your brain and to keep you on track so you're not straining and putting other components of your brain at risk of being depleted. choose, this is my advice, but I will say, I would suggest you choose an independent hearing clinic. We're here to help you hear better. A lot of the retail chains are exactly that. They're retail, they're stores. All they look at is sales. We're here, we're a hearing clinic to provide all the resources, education, and information to help you hear now. And we partner with you over your lifespan to keep supporting you. Receive treatment earlier rather than later, because we know that brain shows evidence of use it or lose it when it comes to the listening parts of the brain. And then just a last slide to show you a little bit more about who we are. So we're Audiology Innovations. We have 5 clinics in and around Calgary, and also in Red Deer if you have any friends or family there. We are independently owned. That means that I'm an audiologist and I run the clinics, and I make sure that our team members are providing the best hearing care to patients. We're local. We're and we're award winning also. So if you're interested in getting hearing care, go online, take a look at our reviews, look at our website. We've recently, in the last year and a half, we've won some pretty significant awards because of our unique approach to hearing care. So let's see, we won a professional award for education. I won that award a couple years ago from the Canadian Hard of Hearing Association, because I do a lot of educational programs for individuals in our community with hearing loss and nationally as well. So that was a national award. We also won an award for provincially, which was for supporting seniors, because we have put together a mobile care program. Like I mentioned, there's a lot of seniors who can't get into a hearing clinic, so we go to them and we support seniors lodges as well. We've arranged a hearing aids recycling program whereby if people, are upgrading their hearing aids, if their older hearing aids are still usable, we work with the Bowness Community Association and the Lions Club to collect them and then refurbish them for seniors on an extremely low income. So that was an award through the Alberta province for Alberta Senior Supports. And then on the top left, we won an award. This one is really interesting, for mentorship. So it's not just all about me. And I would say my team is fantastic. And if you want to come and get your hearing assessed, or if you need help with hearing aids, you can feel confident that you can see any of my team members. And there's one of them in the top left there receiving the award. That award was for mentorship. So I actually sent her to collect the award in Edmonton. That's a provincial award we won, because I have mentored our team members and all sorts of team members from all over the world to become very good hearing care professionals, now offering services in Calgary. So last thing to say, go on our website, sign up for our newsletter if you're interested, because I do send out about twice a month really interesting information about hearing health, including updates to research, including myths about hearing and hearing tests and hearing aids and all of those good things. So if you go on our website, AudiologyInnovations.ca, you can simply sign up for our website there. Okay, I'm at 11:13, so I've spoken for almost 45 minutes, which is what I was hoping to do, so that we can leave a good 10 minutes for questions if there are any. Yeah, so I guess I'll wrap up by saying thank you very much for your attention. I'm glad that you've listened to this, because hearing loss is so prevalent, and it's so important that it's treated sooner rather than later and by thorough hearing care professionals. Thank you.
Thank you, Dr. Scarff. That was great. Just a reminder, if anybody has any questions, they can. I have the chat open. I've also got the Q&A box open, so feel free to ask your questions through those. I have a couple of questions here. Talking about the mental health, individual support as well as family support. So are there any groups or resources that people can access if they're struggling with their change in hearing, or, with the family? I'm not going to say that I haven't yelled up the stairs and somebody said, "What?" You get but it gets to a point where sometimes, you get frustrated. So how do people deal with that?
So that's a great question and great comment. So there's two sides to it. There's the person who has hearing loss, and if they need support and resources, there are um, there's peer support at the Deaf and Hear Alberta Association. So they can look that up online. They have all sorts of, it's a nonprofit, and I'm a big supporter of them. I have been on their board of directors for 11 years in the past, but they have great resources. So that's Deaf and Hear Alberta. So that's for the person with hearing loss, but also for the person who is having to deal with the person with hearing loss, maybe the spouse, maybe the caregiver, maybe the family. That's really important to consider also, to your point. So, we have to remember that communication is a two-way street. We're sending the message and the other person has to hear the message. So there's some skills that we can develop to send the message better. And that's one of the things that we look at when a patient comes into us. We actually highly recommend that not just the person with hearing loss comes in, but they bring their communication partner, whether it's their spouse, their daughter, their friend, and they come in together. And then we take the time to talk about some what we call communication tips so that we can help get our voice, our message to the person with hearing loss more easily. So we'll talk more about that in one of the next presentations, but there are very simple tips that people can do, and we have a handout about that as well. So that's part of what we do. When we say patient-centered care, it's not just about the patient, it's also about the people in their world who they communicate with. And we're offering that extra level of support to help educate them so they don't get as frustrated also.
Excellent. So we have some questions. What is the difference between hearing evaluation and hearing test? What should they expect to pay?
Okay, so that's a great question, and I touched on that earlier. So a hearing test will generally just provide that graph I showed. And of course, a graph is just scientific. It tells us a little bit of information. A hearing evaluation is what we do, where we will sit down with the patient and talk to them about their listening environments and talk to them about the places where they have difficulty hearing and listening and where they might like to hear and be able to listen better. A hearing evaluation would also include what we call speech testing, which I touched on. So it evaluates how well they can hear words, not just beeps. And in our clinic, which is unique, we also include evaluating how well someone can hear in a noisy place. We do charge a fee for our hearing evaluation. I believe it's $75 for the hearing evaluation, but we spend a good hour with that. And for patients, for any senior patients who are on the Alberta Senior Supports Program, we have a sliding scale for that. But it's important to get the right care. I will truly tell you, I used to work at Alberta Health Services. They don't do all of the testing or all of the evaluation portions that we do. So yes, you can get a free test, at Alberta Health Services, but that's not a full hearing evaluation like what we offer. Yes, you can get a free test as recommended by a bus bench, but it's not a full hearing evaluation that you would get with us.
So when you've had your testing done and they come back and they say, you're within normal parameters for your age, that's when you need to look for an alternate solution.
Great comment. Hearing loss is exactly that. If there's any hearing loss, you do not have normal hearing, and you should be talking to someone who goes into more detail. The research is clear, even a slight hearing loss. And so I don't believe in the description hearing loss for your age. I just simply don't accept it. Any hearing loss is hearing loss. The brain's research supports me on this. My background, my Ph.D. is in auditory behavioral neuroscience, and it's in how the brain changes with hearing loss. And we know very recently, research has shown even a slight change to our hearing changes how our brain functions. So if you've been told elsewhere your hearing is normal for your age, that's not good enough in my opinion. And my opinion is based on a Ph.D. in auditory behavioral neuroscience.
Sounds good. I've got another one here. It's hard to have hearing aids having vertigo regularly. So is there anything, if people are having balance issues or with vertigo, any ways around that?
Okay, so that's an interesting question. I'm not exactly sure why it's hard to have hearing aids with vertigo. So I wear hearing aids and I don't have vertigo, but I do yoga. And so I do downward dog. My head is down, my head is up, my body is moving. I do a lot of different kinds of sports and activities, and I can wear my hearing aids. So, that's something that perhaps should be looked at with a full appointment. We can investigate further, make some suggestions. Yeah, that's one thing to mention. Even if people have hearing aids, if they're struggling with them, if they're having challenges with them, we can do an appointment where we evaluate what's going on and see if we can help get them on track. We would do a hearing test, but we would also look at their hearing aids and see what we can do to manage the situation better. And it can be something as simple as relearning how to put them in properly. We have a lot of patients who come to us from other clinics that are essentially stores, and the patient just hasn't been provided the correct follow-up care. So they don't know how to get them in correctly, or they're sliding out or falling out. So the patient has put those hearing aids that they've invested into their drawers. And so we can help in those scenarios also.
Okay, I've got one here. It says hearing loops are used in the UK and Europe. Why don't we use them here in Calgary?
So that's a great question. And I would agree with you. We should use them more in Calgary. There's 2 points to this. Unfortunately, 2 answers to this question. Number one, there are some places that have hearing loops, like there's a church by my house that has one. There are some locations, seniors community associations that have installed them. Unfortunately, I will tell you truthfully, a lot of the new hearing aids that the manufacturers are producing don't have the capacity to receive those signals. They need what's called a T-coil, and the manufacturers aren't creating hearing aids for people who have mild or moderate hearing losses with T-coils anymore. So I don't know where the field is going in that department, unfortunately.
Okay. And for those of us who don't know what a hearing loop is, can you
Oh,
describe that?
sure. So it's an electrical system that basically goes around a room in a loop. And so within that area, so it might be like a community hall, anywhere within that zone, if somebody is presenting, let's say it's a yoga instructor, the yoga instructor could wear a little microphone and then their voice would go into your hearing aid directly, as long as you have a hearing aid that has what's called a T-coil. So it's a way of sending sound from where you want to hear it right into your hearing aid. So in Europe, like the bus stations have it, train stations have it, for example.
That would be handy. What are your thoughts around the new style of headphones that work? I guess they sit behind your ear and they hit the bone as opposed to stuffing things in your ear.
So those are called bone conduction headphones. Yeah, I mean, I would say good. The sound quality can be very, very good. I have some patients who wear them. So like I'm wearing hearing aids right now. I'm wearing headphones over top of my hearing aids so that my hearing aids can help bring the sound correctly into my ears. So this is one option for hearing aids. Bone conduction headsets can work too, but sometimes, for someone who has hearing aids, they might not be a good physical match because they would be in the same real estate on the side of your head behind your ear. But for people who have normal hearing, a bone conduction headset can be good. Or if you have hearing aids and you don't want to wear your hearing aids when you're wearing your headset, you could try a bone conduction headset. So just like anything, there's quality and there's less good quality. So it really depends on the company that's providing.
Okay. Let's see if we have any other ones. I don't think so. How can people access the mobile care unit? Is that just in Calgary here?
So yes, we provide mobile services in Calgary. We do a few pop-up clinics in different locations like Banff and Canmore. We will be providing mobile care service in Red Deer within the next year also. But we have a physical location in Red Deer. So all they have to do is just call our clinic, the main number, which is 403-252-4722, or they can check our website, AudiologyInnovations.ca, and they just have to ask for a mobile appointment. And then
Okay.
we can arrange for one of our clinicians to go to them.
Okay. And gonna wrap this up with the Q-tip question.
Ah,
Thoughts on Q-tips, proper use, don't use them. How do you keep your
great.
ears safe?
Okay, so just like our moms and grandmas told us, never put anything in your ear yourself that's bigger than your elbow. I would agree with that. As a hearing care professional, I would agree with that. You should not be using Q-tips, but I know a lot of people do use them. So if you do, just be cautious. I had a patient who was using a Q-tip and their toddler jumped on their lap, bumped their elbow, and they actually ruptured their eardrum. But beyond, the damage to eardrum, which is pretty unlikely, you can also scrape your ear canals, which, they're very sensitive and you can cause bleeding to your ears. You can also push the wax down deeper into your ear. So that's one of the things that we go over. We have a handout. We explain how you can take care of earwax in your ears more safely. What I usually recommend is just, some ear drops, and we have different recommendations, but ear drops in your ear to soften up the wax for several minutes, and then using what we call a bulb syringe. So it's like one of those little squirt syringes with lukewarm water into your ear over the sink so that it helps get the water out. So, but we can go into, detail. Those are the kinds of things we go into in detail in a full, thorough hearing evaluation.
Okay. And if people are using those earbuds that do get you shove into your ears, does that make you more prone to having impacted earwax?
It really depends on the person. So, everyone has a different shape of ear canal. So your ear canal is like a tube. So if it's really small, yes, it can, by wearing AirPods or any kind of earbuds, it can shove the wax into your ear and it's harder for the wax to come out. Normally, if we have an average size ear canal, when we talk and chew, it moves our jaw and that helps push the wax out naturally, kind of like a conveyor belt. But again, it depends on the person's ear size, shape, how much wax they produce, and we go over all of that at their appointment.
All right. Thank you so much. I appreciate you
Welcome.
taking the time to share your knowledge with us.
My
I
pleasure.